Hi, I'm Steve Downs. I'm a pediatrician and informatician, and my team has been working closely with the Child Neurology Foundation to, uh, to develop the CHICA Child Neurology System. CHICA is a software system that is designed to improve the quality of care that's delivered, and we believe that CHICA Child Neurology will improve the communication between patients and their neurologists. The way CHICA works is that upon arriving at the clinic and registering in the electronic medical record, the patient, in the case of a teenager, or the patient's parents for a younger child, receives an electronic tablet. The electronic tablet contains 20 questions that are selected specifically for that patient based on the data in their electronic medical record. The teenage patient or the parent of the younger patient answers these 20 questions in the waiting room before going in to visit the physician. When they first open the tablet, they have to register using their patient portal credentials. They need to confirm which patient is being seen today, and the system will then tell them which data in the electronic medical record CHICA will access in order to do its work. At that point, they can allow CHICA to have access to the medical record so that it can proceed. Again, CHICA will confirm that this is the right patient and instruct them to fill out the questions that follow. Next, the patient starts filling in the questions. The first one here asks whether the patient has epilepsy or has had seizures, and the patient has answered yes. Other questions that are completed can address issues such as high-risk health behaviors, screening for depression, even questions about asthma or other health conditions. It may ask if the patient is having difficulties in school, so that these issues can be addressed as well. Once the form is completed, there may be a few additional questions. In this case, because the patient has epilepsy, the system asks some secondary questions about frequency of seizures. It also asks about any barriers to taking their seizure medications, and if they're having any difficulty getting to their neurology appointment. Once the form has been completed, the encounter begins, the physician is able to access CHICA through the patient's electronic medical record. What the physician sees is an agenda consisting of 6 items. This first item is discussing the patient's seizures and reminds the physician to talk about medications and sudden unexpected death in epilepsy. Other items can cover things like asthma, substance use, guidelines about vision screening, and so forth. The physician can discuss each of these items with the patient and can quickly document how he or she has responded to that item by clicking the responses under each of the items shown. This process improves the communication of the patient's risk factors with the physicians and allows them to address the most important items that came up. CHICA also allows the physician to quickly review the responses that the patient or the patient's parents gave to the 20 questions that were delivered in the waiting room. CHICA also suggests handouts based on risk factors identified, such as discussing SUDEP or filling out substance abuse screeners and so forth. These items can be printed out by the physician and used in their discussions with the patients. CHICA actually has multiple handouts, and the physician has access to any of these handouts that he or she may think they need during the encounter. At the end, the physician can complete the form by signing, and the information will immediately go back into the electronic medical record. CHICA then can provide a summary of all of the information it had collected in a prose format the physician can pull this into their electronic medical record as part of their note and edit it as needed. If you need any other information about the CHICA Child Neurology project, you can check the website at the Child Neurology Foundation shown at the link below.